If you love spending time in your garden, you've probably gotten a scratch or two from a rose thorn. I mean, it happens, right? But what if one of those little cuts just wouldn't heal? And then it started to travel. Today, we're going to dig into Sporotrichosis, a surprisingly common fungal infection that goes by a much more famous nickname, rose gardener's disease. Hey everyone, and welcome to MediByte. Our whole goal here is to cut through the jargon and make medical topics easy for everyone to understand. So let's get right to it. I want you to think about it for a second. Have you ever been out in the garden, maybe pruning some roses, and gotten a little prick from a thorn? Seems totally harmless, but that exact situation is how so many people get this infection. It's no wonder it earned that memorable nickname, rose gardener's disease. So here's what we're going to cover. We'll start with what this rose gardener's disease actually is. Then we'll look at how the infection gets started in the first place, the telltale signs it leaves behind, how doctors figure out what's going on, and of course, the path to getting better. Okay, first up, let's get to the root of the problem. What exactly are we dealing with when we talk about this rose gardener's disease? Well, at its heart, sporotrichosis is an infection, but it's not from a bacteria or a virus. Nope, it's caused by a fungus called Sporothrix, and this little fungus lives in the soil and on plants pretty much all around us. So if this fungus is just hanging out in nature everywhere, how does it make the leap from the dirt into our skin? Let's break it down. You know, the Sporothrix fungus isn't picky. It really thrives in soil and on all sorts of plant stuff. We're talking rose bushes, sphagnum moss, even hay and mulch. So yeah, it's very likely present in a whole lot of gardens and backyards. So here's the key thing to understand. You don't usually breathe this fungus in, like you might with other fungal infections. For Sporothrix to get in, it needs an open door, and that doorway is usually a tiny break in your skin, a small cut, a scrape, or, you guessed it, a prick from a thorn. It totally makes sense then that people who get their hands dirty are at a higher risk. You know, farmers, gardeners, landscapers. But here's a real curveball: cat owners. It turns out cats can carry the fungus and pass it to us through a scratch or a bite. Who knew? There's sort of an unexpected link in the chain. Okay, so the fungus has managed to sneak in. What happens next? Well, let's take a look at the classic trail of sores that basically screams, this infection is here. It usually kicks off with a small, painless bump, often on your hand or arm. Over a few days or weeks, that bump gets bigger and can open up into a sore. But the real giveaway, the thing that makes doctors sit up and take notice, is what happens next. The infection often starts to travel along your lymphatic system, creating this distinct line of new sores leading away from the original one. It's like a trail of breadcrumbs. Now, this is really important to understand. The huge majority of cases are what we call cutaneous, meaning they only affect the skin and the lymph nodes nearby. This type is very treatable and rarely dangerous. But in very rare situations, especially for people with weakened immune systems, the infection can go systemic. That means it spreads inside the body to the lungs, bones, or even the brain. And that is far more serious and can absolutely be life-threatening. So, if you've got this suspicious trail of sores, how does a doctor actually confirm that sporotrichosis is the culprit? Well, it usually starts with a doctor's hunch. That classic line of sores combined with your story, like, yeah, I was gardening last week, is a huge clue. But to be 100% sure, they need proof. So they'll take a tiny sample of the infected tissue and send it off to a lab. There, they'll try to grow the fungus from that sample in a special dish. If Sporothrix pops up, you've got your diagnosis. And while growing it in a culture is the old-school, reliable way, labs have some high-tech tools now, too. Things like a PCR test can actually spot the fungus's specific DNA right from the tissue sample. It's often a much faster way to get a definite answer. All right, now for the part everyone wants to hear. How do we fix it? Let's talk about the path back to health. The great news is that sporotrichosis is definitely treatable with antifungal meds. For that common skin infection, the go-to treatment is an oral medication called itraconazole. But for those rare, really severe cases where it's spread throughout the body, doctors start with a much more powerful drug called amphotericin B, which is given through an IV. Now, one thing you have to know about fungal infections is that they are stubborn. This is not a quick fix. You have to be patient. For the really severe infections, a full course of treatment can take up to a whole year to make sure that fungus is completely gone. And for folks whose immune systems are severely compromised, say someone with advanced HIV, managing this becomes a long-term thing. To stop the infection from ever coming back, they might need to keep taking that oral medication, itraconazole, for the rest of their lives, even after the first infection is gone. So let's just boil this all down, shall we? Sporotrichosis is a fungus from the soil that gets in through a cut. It creates a pretty unique trail of sores. Doctors diagnose it with a lab test, and it's absolutely treatable with antifungal medicine. But the biggest takeaway for you? Don't just ignore a sore that won't go away, especially if you're a gardener. It's always, always worth getting it checked out. And that kind of leaves us with a final thought, right? Next time you're out there enjoying your garden, just remember what we talked about. It makes you wonder, doesn't it? Could that little sore that's been hanging around be more than just a simple scratch? If you found this helpful, do us a favor and hit that like button, share it with your friends who love to garden, and be sure to subscribe to MediByte for more clear, simple health explainers. Thanks so much for watching.